Hi, so today we'll be studying diagnostic algorithm of urinary tract infection. So first is that we have a clinical suspicion of UTI. So we'll take a sample. Sample will be of a urine sample. It will be collected in a wide mouth screw capped container. There are three methods. First is clean catch midstream. Second is suprapubic aspiration. Third is we collect it from catheter. Then we have to process it immediately. Third, we'll take it for direct examination under microscope. If we see pus cells more than 8 cells per mm cube, and we'll do dipstick test. Dipstick test, there are two: leukocyte esterase test and nitrate reduction test. Then we'll do urine culture. Urine culture we'll do in McConkey agar, blood agar, and Cled agar. Then we'll do CAS, concept of significant bacteriuria. In this, if there are more than 10 raised to power 5 colony forming units per mm cube per ml, then it means there is infection. This colony forming unit we have to see on these agars. If there are more than 10 raised to power 5 colony forming units per ml, then there is infection. When there is 10 raised to power 4 to 10 raised to power 5 colony forming units per ml, it is doubtful. And when there are less than 10 raised to power 4 colony forming units per ml, it is a contamination. Then we'll do identification of the organism. We can do it with the help of culture. Then we'll do it smear, biochemical test, Malditov and Vitek. Then we'll take it for antimicrobial susceptibility testing. For appropriate treatment, we do it using Muller-Hilton agar or Vitek. Then we'll report and do the treatment. For treatment, we use quinolones, for example, norfloxacin or nitrofurantoin. These 6 organisms mainly cause a urinary tract infection. We can learn their names using EC, PES, E for E. coli, Klebsiella pneumoniae, Proteus, Enterobacter, Staphylococcus aureus, Staphylococcus saprophyticus. First is E. coli. For our identification, we'll do culture, smear and motility, and biochemical test. E. coli, in McConkey agar, it is pink lactose fermenting, and in blood agar, it is grey moist colonies. Klebsiella on McConkey and Cled are mucoid lactose fermenting. On blood agar are grey mucoid colonies. Proteus on McConkey and Cled are non-lactose fermenting, and on blood agar it shows forming type of growth. Enterococcus on McConkey agar it produces pink translucent colonies, and on blood agar it is non-hemolytic. Staph aureus on blood agar it produces golden yellow hemolytic colonies, whereas Staphylococcus saprophyticus produces white non-hemolytic colonies. Then culture smear and motility testing. E. coli is a gram-negative bacilli and motile. Klebsiella is gram-negative bacilli non-motile. Proteus is gram-negative pleomorphic bacilli and motile. Then Enterobacter, it is gram-positive diplococci, spectacle-shaped, non-motile. Staphylococcus aureus is gram-positive coccus and cluster, non-motile. And Staph saprophyticus is gram-positive coccus and cluster, non-motile. We'll do biochemical test. We'll do catalase and oxidase. E. coli is catalase positive, oxidase negative. Klebsiella is catalase positive, oxidase negative. Proteus is also catalase positive, oxidase negative. Then Enterobacter is catalase negative. Staphylococcus aureus is catalase positive and coagulase positive, whereas Staph saprophyticus is catalase positive, coagulase negative. We also do ICUT test. E. coli is I positive, indole positive, C negative, U negative. Klebsiella is I negative, C positive, U positive. Iska opposite. And Proteus is I positive negative, C positive negative, U positive. Thank you.